We will now assess one very last thing, controversial statements. If you cover the vaccine controversy, you will come upon unfounded tropes about vaccination which are thriving in many communities. We will now explore how a science journalist can assess factual as well as value-laden statements about vaccines. The first statement we will assess is vaccines are toxic. The first step would be to look for the National Safety Agency or body in your country. They're listed under the vaccine safety net. But beware of pseudo-vaccine safety bodies like the Vaccine Safety Commission, which is mainly against vaccines. Then there is the Vaccine Education Center of Dr. Paul Offit, who has written many books about vaccines. And the University of Oxford has the Vaccine Knowledge Project. And there are more specialized documentation on thimerosal and vaccines. And then blogs produced by graduate students like Understanding Vaccines from Andrew Abraham from Fresno State University. And then a team of doctors, veterinarians, and public health officials have put together Just the Vax Please. Have you heard these toxic vaccine myths? And how about vaccines are unnatural? For sure, if you let do Mother Nature and survive unscathed, waiting until you catch the disease can give you a very strong immunity. But this is precisely why vaccines exist. Vaccines cause a natural immune response in the body without causing the illness. In other words, they immunize against the disease, they don't give it. All this is superbly explained in Natural Immunity from the Colorado Children's Immunization Coalition, and you can also look at the Parent's Guide to Childhood Immunization put together by the Center for Disease Control in the United States. We have already come across some people saying that vaccines are an attack on freedom. You can contact social scientists. Many of them are studying what is called vaccine hesitancy. And in the story you might mention herd immunity. And it's beautifully explained on some websites. WebMed, for example, should vaccination be a personal choice, or why we should aim for 100% vaccination coverage in the Conversation, a paper that was written in February 2016. And there are excellent examples of herd immunity that can be found on the web. We also looked at this statement that there is a growing worldwide epidemic of chronic diseases and disability. That statement came from the Children's Medical Safety Research Institute, and they blame vaccines for this world's health that is deteriorating. In fact, if you go to the website of the World Health Organization, you will find a lot of documentation explaining that now, because people live longer and they have access to more food, there is a rapid increase in the number of people affected by chronic obesity and diabetes. So it has more to do with lifestyle and nutrition than vaccination. And there is this statement that big pharma and governments hide information. But in many countries, health professionals are required to report adverse events following immunization. It's impossible to prove that a conspiracy doesn't exist, but this registry is available. You can look at the reports that doctors file each time they are told that someone who was vaccinated had a reaction. For the United States, you can access that report. It is a big Excel table. This is just to give you an idea of what it looks like. Each line is a report from a medical doctor about some side effects from a vaccine. And you can do search on the Excel table using words like seizure or fever or headaches, and you will find out really what is happening when people get vaccines. We have also already looked at the statement that unvaccinated are healthier than vaccinated people. I urge you again to look at the critiques of the Mawson papers that exist on the websites. Snopes has done a great review of Mawson's article, and it is a great introduction to how methodological design can be tweaked to come up with the conclusions that you're looking for. Only 2 more modules, and the next one describes the new environment in which science journalists need to work.